So today we will look at a disease process that causes 2 million deaths worldwide per year. For case 1, the patient has a red cell count of 3.2, hemoglobin of 95 or 9.5, and a hematocrit of 0.29 or 29, which are all decreased. The MCV is 90.6, which is normal. MCH is 29.7, which is slightly decreased, and the MCHC is 328 or 33, which is normal. The RDW is normal at 13.5 with a platelet count of 100, which is decreased. But the MPV of 92 is normal. The differential is not clinically significant in any of the cases. On the slide, we see many target cells intermixed with normal cells. For the second case, we have a patient with the same CBC as the previous case. I know it's impossible, but it makes it easier not having to make up mathematically correct CBC results for every patient. On the slide, we see a lot of stomatocytes intermixed with normal cells. In the third case, we have a red cell count of 2.6, hemoglobin of 93 or 9.3, and a hematocrit of 0.29 or 29, which are also all decreased. The MCV is 111.5, which is increased, and the MCH is 35.8 and normal. The MCHC is 321 or 32 and is also normal. The RDW is slightly increased at 17.5, and the platelet and MPV are the same as the previous cases. On the slide, we see round macrocytes. To summarize, all 3 patients have an anemia. The 2 cases have a normal MCV, while the third has an increased MCV. And if you remember from previous videos, this parameter deals with the size of the cell. An increase here means that the cells are larger than normal. This last case also has an increased RDW because the cells are likely a mix of large and normal sized cells. The platelet count is decreased for all 3 patients with a normal MPV. The 3 slides have target cells, stomatocytes, and round macrocytes respectively. When I see these cells on the slide, I will automatically look further into the patient history and their biochemistry results, particularly their liver function test results. These tests are albumin, which is synthesized in the liver, alanine transaminase called ALT, alkaline phosphatase called ALP, and aspartate transaminase called AST. These are all enzymes found in the liver. Gamma-glutamyltransferase called GGT is an enzyme found in the blood, and bilirubin, a substance produced during the normal breakdown of red blood cells that passes through the liver before being excreted in the stool. In these 3 patient cases, the albumin is decreased, and there is an increase in any or all of the liver enzymes. If you haven't guessed, we are looking at liver disease today. In Canada, 95% of liver disease deaths are due to chronic hepatitis B and C, alcoholic liver disease, non-alcoholic fatty liver disease, and liver cancer. So knowing what to look for at the microscope is a major skill. The 3 cases I've shown you are some of the ways it can manifest in the peripheral blood, but they are not the only ones. The patient can have a lot of acanthocytes, a mixture of all these red cell shapes, or they may have a normal red cell morphology but have an anemia. The liver is essential for synthesizing many proteins, including plasma coagulation factors, lipids, and is essential for metabolic reactions. Anemia is commonly associated with liver disease due to the red cell's significantly shorter lifespan, though this is not fully understood. Thrombocytopenia occurs in approximately 1/3 of patients. This reduction can be due to the sequestering or shortened platelet lifespan. In alcohol-related diseases, alcohol is acutely toxic and can suppress platelet production. Also, a big aside, the body doesn't care if the patient identifies themselves as an alcoholic. Alcohol is toxic at any level, and if alcohol is consumed over the amount that the liver can safely metabolize, it will cause damage. People should be consuming alcohol based on the low-risk guidelines that I have on the screen. In reality, liver damage can occur even at these levels because it says low risk, not no risk. So keep that in mind. Also, in Canada, non-alcoholic fatty liver disease is the most common liver disease, affecting 7 million Canadians. So take care when you are looking at a patient's history. Okay, time for me to get down off this soapbox. It is high. Whew, may need a ladder. Now you know about liver disease. Check out this video here, which will continue you on your hematology journey. Thank you for watching. Until next time.